Hello everyone, my name is Grace and I want to present an article from the New York Times about Dr. David Goodall's decision on his death by looking at 4 bioethical principles related to physician-assisted suicide and euthanasia. This event was very intriguing as I am interested in quality of life and burnout issue in patients with terminal illness. Dr. David Goodall, renowned Australian botanist and ecologist, decided to end his own life at age 104 through euthanasia at a clinic in Switzerland last May 10, 2018. He chose to be administered 15 grams of Nembutal IV by turning the wheel on his own with his chosen music of Ode to Joy by Beethoven. His grandchildren show a respect for Dr. Goodall's decision as a brave pioneer, while the Right to Die movement greatly supported his decision of death with dignity by pointing out the significance of autonomy and beneficence. In bioethical principle, autonomy is defined as a patient's intentional decision-making based on understanding and freedom of constraint. Beneficence means healthcare providers act for the benefit of the patient. In this sense, the Right to Die movement, including Dr. Goodall's, view euthanasia as a good and merciful instrument to terminate pain and suffering in a protracted period by respecting one's right to die. Currently in USA, California, Colorado, Hawaii, Oregon, Vermont, and Washington have legalized euthanasia. However, some professional and religious organizations are also against the Right to Die movements based on bioethical principle of non-maleficence. Non-maleficence means healthcare providers act to avoid causing harm to patients. The ENA also officially stated their position by prohibiting nurses' participation in assisted suicide and euthanasia in 2013, as it is not only against their code of ethics, ethical tradition, and covenant with society, but also violates the bioethical principle of non-maleficence related to potential risk for abuse or misuse physician-assisted suicide. Dr. Goodall's case is significant due to the extension of assisted suicide from patients with terminal illness to the geriatric population who is placed in the protracted period of dying. With dramatic growing number of geriatric population in nationwide, this can potentially affect nurses' scope of practice in providing care for geriatric patients at the end of life. Also, as several states allow the nurse practitioner to practice independently without supervision of physician, there are potential challenges to deal with geriatric patients requesting medical aid in dying. Current literature states there are existing resources such as palliative care, hospice, advanced directive medication to replace assisted suicide or euthanasia by promoting patients' autonomy, beneficence, non-maleficence, and justice. Also, the World Health Organization found the greatest improvement in quality of life for patients with terminal illness through the education in pain and symptom management. However, even with existing research and positive research results as an alternative, few healthcare professionals are trained or are able to educate patients, families, and government policymakers about this existing research. Therefore, ANA is suggesting nurses to advance knowledge, skills, and attitude in providing palliative care, symptom management by emphasizing its importance. Dr. Goodall's case reminds me of a dialogue with my 86-year-old female patient with terminal illness. She told me, "Grace, I never thought I would live this long. Living is pain, but dying is so hard. I am here, but my life left me." Class. Working in the hospital setting, we encounter patients fighting between life and death within the protracted period. The analysis of the events point out the ethical role and responsibility of healthcare providers is to kill a pain and suffering within the patient's life, not to kill the patient. Rather than providing medical aid to kill a patient, healthcare providers should actively participate to educate in palliative care and advance directive as well as outreaching to the media, the public, and the government for increasing awareness of alternatives for physician-assisted suicide and euthanasia. Thanks for listening.